This is ASAP Pathway. Hi, everybody. Welcome back to another episode of ASAP Pathway, the podcast. I'm your host today, Dr. Stacy, and I've got Dr. Tracey with me. And she actually, for those of you watching the YouTube version, she just disappeared and now she's back.
Just trying to get rid of some of my lighting here. I don't know.
Okay, I'm like,
This is the reflection of my
she's
glasses.
gone.
I'll be right back. Hold on.
Okay, I'll see you in a minute. But I'm really excited today. I am always excited. I love this podcast. It gives me, I'm selfishly have just fun opportunities to talk with friends, talk with people, learn myself, and hopefully someone out there is getting something from this too. But today I have my friend and colleague, Dr. Lena Sapozhnikoff, right?
Yes,
Did I
correct.
say it right? Sapozhnikoff.
Yes,
What a fun.
absolutely. Correct.
And she is one of our ASAP members and I told her this before we started recording, a complete, utter rock star unicorn that you guys need to hear her story and hear what she's doing because it's fantastic. And I know that there's listeners out there, Lena, that have a similar background to you that don't know how they can jump in. So I think you're going to really help a lot of people today and even maybe some patients that could benefit from your care too. But for people that do not know you, Lena, I would love to introduce you and dive into this conversation, if that's okay with you.
Absolutely. Pleasure to
Um,
be here.
oh, I'm so happy you're here. Thanks for taking the time too. Dr. Lena is passionate about complete health dentistry, where oral health, airway function, and overall well-being are deeply connected. She trained at Columbia University College of Dental Medicine. She takes an interdisciplinary approach to care, blending advanced orthodontics, airway focused treatment, and restorative dentistry to create transformative, lasting outcomes. Collaboration with other health professionals is central to her philosophy. She believes that truly personalized care requires a team-based approach, one that supports her patients' broader health goals and empowers them to live healthier, more vibrant lives. She completes hundreds of hours of continuing education, no joke, I'm a witness to this, each license cycle so that she stays at the forefront of MARPE, modern orthodontic protocols, and comprehensive restorative techniques, ensuring every treatment plan is thoughtful, innovative, and whole body focused. And when she's not practicing, you'll find her enjoying life in the city, flowing through yoga, experimenting in the kitchen, or reading by the beach in her flip-flops, and just, we learned, playing the drums. Welcome.
Thank you.
So happy to have you. Lena, I remember, matter of fact, the first time I met you, Tracy, I think we were in New York City and we were just doing our very first photo shoot like maybe 4 or 5 years ago.
Yes, yes.
Oh,
And
yeah.
we all
Yeah.
we all went out to eat. And then I heard Lena's joining us for dinner. She lives in New York. And I'm like, oh my gosh. And you are just a force. You're just a wonderful force. You are brilliant. Your treatment plans are so thought out and comprehensive. Like in our forum, we share, cases, and your cases are so comprehensive, so thought out, so whole body. You're just amazing. So I would love to jump in first.
All right.
Your background is a restorative dentist. So tell us about your journey. Like you're going along in life, practicing restorative dentistry. What changed the trajectory of this intensive learning path for you?
It was pretty gradual, I would say, because I was doing Invisalign for my patients, and it was just kind of like, I would say very basic at the time, but I was looking at it as a tool to improve restorative outcomes as well. Um, for veneer patients, but the more you do that kind of work, the more you see different kind of orthodontic patterns. And I really feel like I was guided into this by a patient with an anterior open bite. I kind of started to notice that patients with anterior open bites are relapsing a bit, and that was disappointing. But this particular patient had an open bite that I didn't think that I could close with Invisalign. She looked very skeletal to me, even with my, at the time, limited knowledge. And she said that she started doing myofunctional therapy. I was like, oh, what is that? So the patient explained it to me, and um, she said that she was identified to have a tongue tie. So I started looking into that and how does the tongue play a role in the shaping of this facial skeletal structure. And somehow I found Dr. Zaki's course, and I came upon American Academy of Oral Systemic Health. And I went to that meeting, and that's where I learned about tongue ties and about influence of tongue ties and airway and facial structure. So I really feel like listening to the patient was super important and developing my interest in airway orthodontics.
So when got the you got the bug for airway orthodontics, like, I mean, there are a lot of courses that you can take out there. So what was your, because someone listening right now, there's a listener like, I'm interested in learning more orthodontics. So what was your criteria for picking, I think I'm going to go this way?
What was my criteria for picking the courses?
Yeah, like what was your thought
Um,
process? Like because there's a lot of options out there for ortho courses for general practitioners, but what are the things that you're like, these are the things I'm looking to help my patients with, and that's why I'm picking this course.
so I realized that structural changes are important in shaping orthodontic outcomes. And one of the first courses I was taking to learn how to use Invisalign was with Dr. Miralia. And then I learned that he was teaching this expansion course. So I took that. That was my first kind of like structural course. And that led me to ask more questions. So how do we do this better in adults? Can we do this in adults? What does that mean for adult expansion? How can I optimize my appliances to give the best outcomes? And somebody recommended the ASAP pathway to me. And I think it was actually Tracy's friend Ellen.
Oh,
I know that
Ellen.
I was taking courses with Ellen, my restorative courses, and she was one of the mentors. And I told her, oh, there's all of this structural orthodontic work that we can do to optimize our restorative. And she introduced me to your course. And from there, it was just a wealth of information. I started listening to all of the lectures, and that led me to ask more questions. Oh, what is MARPI? What is SARPI? What does it actually do to the maxilla? How can I take more courses? And I think that was around the time that COVID started and there was really
Mhm.
nothing to do.
Yeah.
Yes.
And I've learned that Juan Moon is teaching. He developed MSC. What is MSC? How do I use it? So I reached out to him on Facebook, and I was like, "Do you have an online recording of a course? Can I purchase a course?" He didn't have anything recorded, but he said that, oh, once the pandemic is over, he'll probably have a course. And then I somehow figured out that Mariana Evans was teaching these courses, and she did have a digital course. So I purchased her course in like 2020, and I listened to that, and that was just
She-
eye-opening and
She's
fascinating.
amazing. A shout out to
Yeah,
Mariana
I,
Evans.
I was just like searching. I want something that I can learn from, something because there's nowhere to go. You know, you're sitting cooped up at home, you're in a mask, and we can't go outside. I needed to do something. I actually redid the Zaki course during the pandemic, and then I got Mariana's course, and that was just like, wow, I can split the maxilla open and make the bone grow. That was just phenomenal to me. All of these severe crowding cases that I wouldn't know how to approach, that really gave me a completely new perspective.
It
So
really does. It really
I think what's
does.
great about Lena, and it's we have very similar journeys. Like we're heavy restorative first, and I think that's probably, Lena, that's the missing link with a lot of these big cases now is like the restorative component, the facial aesthetics, but that's our original background,
Yeah.
I mean, what So, and I knew that with Lena, like I was like, okay, because I knew you from Ellen, and then like social media, we all really pretty much connect through social media as we start to follow each other. We're like, hey, that makes sense, and start asking each other some questions. But you've really, I mean, I think like just watching your journey and your growth, I mean, absolutely amazing.
Mhm.
What you are doing, and then, I mean, we're very thankful that you're a part of ASAP and you're mentoring our next course. But what do you, and I think it's, what do you say? Because I find that I feel like restorative dentists are very important in this journey, especially when it comes to adults. I mean, we know now that we can split adults, but we still have to know how to put the teeth in the face.
That's
We
right.
have to put them back together. Actually,
Yes.
mentoring the Invisalign post-market finishing course is full circle for me because Ilya is my mentor. I consider him a mentor, and I met him through ASAP. So I saw his comments in the WhatsApp group and a Facebook group. I was like, I need to learn from this man. He knows things that I need to know. So I just called him up and I was like, can I come to your office? And he said, yes.
He's so
Um,
nice.
you can't just like say, "Oh, how do I learn this?" You
Yeah.
have to take the knowledge. You can't just, and
You
if
got to
you're
do the work.
lucky,
You've got to do the
yeah.
work. Yeah.
I
I
drove
love that you said you have to put the teeth back in the face. I mean, because that,
there.
like, what that's out, like, so me and Lena, we share some stuff and we're like, the teeth are in the wrong place. It's like, I always say, just because you can doesn't mean you should. We have to take into account facial aesthetics and the restorative plan on this.
And I do get some patients who say, "Oh, can you just expand me a little bit because I will breathe better through the nose?" Well, their nose score is low, so it's unlikely nasal obstruction, and their smile is full. You're expanding them, there's no transverse discrepancy. What are you trying to achieve?
Mhm.
Yeah, that's
Not
so true.
every nasal breathing difficulty case is a market case because
Right.
their smile aesthetics just not support that. And you have to start with the face.
Yeah, we have to like put that in quotations from Lena right there. Because I feel like that's the missing link is just because like you can do it doesn't mean you should.
And the way I set up my clincher cases is the way we were taught to set up denture cases in dental school. You
Hmm.
start with the basics, you put the central incisors where they belong, and then
Hmm.
you put everything else where it's supposed to be in the face. Because if you just do this disembodied thing on the screen without having the smile in front of you, you're going to fail.
Well,
Yeah.
and that's the importance of collaboration too. So, if you're a restorative dentist learning this and you have a really strong restorative background, because you really have to start this with the end in mind. What is your diagnosis? What are your treatment goals? And then how are we ending this case aesthetically, restoratively, functionally?
Hmm.
So you do have orthodontists out there that may not have, they're amazing with expansion, but if they don't have a great relationship with a restorative dentist, then they're going to kind of get themselves in the deep end and not know how to get out. So it goes both ways. Restorative dentists are needing orthodontists or other dentists willing to do this procedure and learn this procedure. But there's orthodontists that need to really step out and find that good restorative dentist that knows how to work with cases like this. Um, which you just happen to be able to do both. I mean, your cases are beautiful, Lena. You
Yeah.
finish so beautifully, which I'll plug Lena here. She's one of our mentors, and we have a part two skeletal expansion course coming up with a liner finishing focus. Like now you're expanded. How do you finish
Yeah.
this case with Marpy in mind? And Lena is one of our mentors. Ilya is teaching. So you have two powerhouses.
Yeah.
It's
So this
going
is
to
the
be
first course that we've done. Just we're exclusively only talking about the orthodontic standpoint because I think that Lena, and I don't know if you're saying this, but in probably the last year, I've just been seeing a lot of expansion cases not aesthetically finished well. But we have to kind of talk about that, like where do the teeth fit? And I think a lot of people are struggling with putting the teeth back in. Um, Lena, like, so I mean, you're restorative dentist with a huge, lots of training in ortho. How can someone, what would you get, what advice would you give someone that wants to take the path that you took?
You have to, if you want to do well in a discipline, you have to love that discipline. You can't say that I want to do these cases, but I don't love this process. You have to want to do orthodontics. It is challenging. It requires a lot of orthodontic knowledge. You have to take the courses. I do recommend also taking, just straight wire courses because it'll give you an idea of how different mechanics work. But you have, and I don't do a lot of bracket cases. I do use braces for kind of like gross movements or together with aligners. Maybe I should. I was just trying to think that, oh, I
Well,
only
change
want to
what's
do
working for
aligners.
you.
I want to do I want to do only aligners with TADs, but I still use braces, just not for like full cases because I don't know. Um, I feel like doing a lot of courses overall will give you a much better foundation of how to do. You don't have to do all of the techniques or use all of the techniques that you learn, but I feel like you have to learn the techniques.
Yeah.
And progressive orthodontics has excellent coursework. I may not necessarily want to do it that way, but it gives you an excellent background. And I took a course with Jerry Samson, um, and I thought that was just really eye-opening and how to use braces and how to not use TADs and how to use really advanced mechanics in a simple way. His cases finished beautifully, and it's just amazing to see these kind of results. And progressive orthodontics also teaches general dentists to ABO standards. So I think it's important to understand, the tip and the torque and how to move roots. What are the limitations? Like you really have to understand all of these things. And I also took a lot of implant courses. So bone biology is something that I'm fairly familiar with. So I know how to do these cases in conjunction with implants and what are the bone limitations? Like how far can you move the roots? Can you move the roots? I think taking all of these courses to give you a well-rounded idea of what it is you can do with the case. And if you are not taking them, then you need to know your limits and you need to know how to learn how to work with other specialists
Lena,
and ask questions. You can't if
yes,
you feel stuck, you're stuck. You need to ask
you need
somebody.
to, yeah, ask questions. When you look at MARPI in your practice, what are some of the reasons, maybe some of the side effects, if you will, with this type of expansion that it has given you in your tool belt that you would say, I could never not offer this in my practice because I have seen A, B, and C with my patients, or A, B, and C with my outcomes have changed because of MARPI. What are some of those things that would, because not a lot of orthodontists or general dentists doing orthopedics, orthodontics do MARPI. It's becoming definitely more on the forefront, and you're seeing more orthos starting to do it. But what is it about that technique that brings value, you think, to your practice? What are some examples of it?
Well, MARPI was developed as a periodontally protective technique, so it wasn't developed for airway. If you're just looking at the teeth and where they are in bone, we want the teeth to be centered in bone and not going through the buccal plate. Right now, Invisalign gives us this amazing opportunity to see where the roots are. And if you integrate the CBCT with your STL, you see where the roots are. Maybe it's not 100% accurate, but it gives you a pretty good idea. So if you're going to move the teeth and if you have to move them that much and you see them going through the buccal plate, just looking at these cases from a periodontal perspective, you
Mm.
cannot not offer MARPI. Sure, you can do SFOT, you can do all this fancy grafting, but then why not look a little bit further? The structure is too small. What are you doing for the maxilla by just adding some grafting? So you have to ask questions. What is going on with this case? What is the real issue? Is are the teeth just in the wrong place, or is there a real skeletal transverse discrepancy? it's really difficult to walk back and to not think that way because I already know this. So
Hmm.
you have to have a checklist, is there a skeletal discrepancy? Is there a periodontal defect? How much can I move the teeth? Where are the teeth in the face? Is this going to be stable long term? So sure, we can close open bites with Invisalign, but are they going to be stable even 2 years from now? Because with with three plane occlusion cases, we know that there's a high level of relapse without jaw surgery. Okay, not a lot of patients are candidates for jaw surgery because that's not something that they want, or they're mild open bite cases. But will they still be stable? Like, what is the stability of just orthodontic intervention in open bite cases? And the relapse can be up to 40%. That's huge.
Yeah, it is.
If 50% of your cases don't maintain stability, sure, it looks nice in pictures now, but do you want this patient coming back and saying, oh, this didn't work? Well, it worked for a little bit. It's just their structure cannot support what you were trying to give them. So I think this is a tool that gives you long-term stability and healthy periodontal outcomes. And yeah, over time, people discovered that it gives airway improvements.
It's
And
kind of
what,
like other things in the past,
yeah,
medications that, hey, this was meant for blood pressure,
yeah,
but we
But it also does
found
this.
it
Yeah.
also does other things,
yeah, yeah,
Yeah.
yeah, yeah.
right?
And
Or it grows hair or it grows other things. So it's like, you know, but we again, that was an excellent point, Lena, that it's not just, and um, it's not just about airway. This was really, it's a very periodontally aware, periodontally wise expansion procedure. And I love how when you do your clean checks, do you import your
Yeah.
STL CBCT every time or only in cases where you think I'm
always,
going to be moving the teeth a lot?
always. Well, now I'm a little addicted to it. I'm like, I don't see the roots. I don't know how to do this.
Yeah, now you want to
Not
always see the root.
true.
Yeah.
But it really gives you a much better idea because you can really put them in the right position. The tip and the torque really, I don't know. I don't know how to do it without anymore.
It's a good point. And there are a lot of people doing orthodontics that don't have CBCT technology, and you don't have to have CBCT.
No, they
Oh
do
my
beautiful work.
gosh,
They really, really do. They do it. It looks magical, and I'm very
it
impressed that
does. And
they're doing it.
I couldn't practice without a cone beam. If you said, oh,
Yeah.
okay, you're going to just have a pano and a full mouth series, go. I'd be like, I don't know what to do now.
Yeah, I feel like it's a little bit of cheating at this point when I compare myself to the doctors who did it without and have these amazing finishes and perfect canine class one, with guidance and no interferences. To be perfectly honest, I've had pretty good cases before CBCT, but right now it just makes it a lot easier.
Yeah, it sure does. It takes a lot of guesswork. It
Yeah.
makes it more predictable, more consistent. I'm all about certainty. So the more
Yeah.
certain I can be about
Yeah.
something, the better for us, for the patient, all around. Um,
For growing cases, I can measure, oh, this is the width of this canine that's coming in. Do I have enough space?
Yeah. Lena, you mentioned that what started your journey into this was your patients with open bites. For the restorative doctor, for like what other malocclusions or things that we see every day that we should be concerned about or consider that the patient has a compromised airway? Or what are you seeing in your practice?
Um, so yeah, hyperdivergent patients, of course, would every open bite patient.
Explain hyperdivergent.
Meaning, if they're vertically growing patients,
Yeah.
something happened in their childhood growth that led them to grow clockwise rather than counterclockwise. So the face is supposed to grow in a counterclockwise direction. And if something happened, like some sort of airway obstruction, adenoids or large tonsils that weren't addressed for a while, they will grow downwards instead of forwards. Um, and these patients might not even say, "Oh, I have any airway issues. I'm fine. I'm breathing fine." I'm not going to tell the patient that they're not okay, but the way, if they want to have their malocclusion treatment treated, we may have to do something besides just alignment of teeth. And the patient really has to understand the limitations of any particular technique. Uh, you mean like what are the other malocclusions that we should look into? Um, Bilateral crossbite. So
Hmm.
the legs are very small, and just fits into the lower arch. We're definitely dealing with a compromised airway, but you're going to have a lot of patients in your general practice who are going to tell you, I'm fine. You
Yep.
can get really, really excited about all of these things that you know, but and the patient can answer the questionnaire in a way that, oh, wow, you have so many symptoms. They'll tell you they're not bothering me. I'm fine.
Yeah.
We can't just like fix them because we want to fix them. If they don't find that it interferes in with their life in any way, that's just where they are, and maybe they'll come back to you and say, what you asked me before really resonates with me now.
Yep.
Um, but we can't just like start diagnosing them. I think if you have a restorative practice and you are looking for airway issues, you kind of need to give it to the patient as this is a gift of screening. I'm going to give this to you, and do you want it? And if they don't want it, you can't make them.
Yeah.
Right. Right.
100%. I've always said that. It's like, you don't want to, you start with like screening forms. The patient will tell you when they're ready. You kind of meet them where they're at.
Yeah.
It's just like
Yeah.
shoving it down their throat. Like,
Right. Right.
and
It's
then I think
having
you also have to,
conversations.
Stacey, we always talked about like, especially when it comes to kids, we have to be a little bit sensitive about what we see and how we
Oh my
communicate that
goodness.
too.
Yes. Yes. You can insult people and inadvertently ask me how I know this, but you get so excited because you're like, oh my gosh, look at all these things I'm seeing. Your face is growing down backwards. I mean, you have circles under your eyes.
Your child has a speech issue. Never
Your
say that.
child doesn't, yeah, they have a speech issue. I mean, what they're creating in their head from everything you're saying, it's like my child is a mess. So there's a delicate way to tell anybody. There's just things I'm seeing, growth and development wise. Are you open to a conversation about it? There's some concerns I have. And so I've been really, I've changed my way I present that. And I always make sure I tell the parent just how adorable their kid is. And, they're adorable. They're
Yeah.
adorable. But there's some things I'm saying. And I get it. I mean, I'm a parent. I mean, someone starts telling you everything. It's like, oh my goodness. But, you also want to help your child, and parents will do. Most parents, when they see that there is a problem, and that's what Tracy's point was, you give information. We collect data, and then we come up with information from the data, and then we present that. And sometimes it lands on deaf ears, and that's
Yeah.
okay. They're not ready to hear it. You can't make somebody hear something or, process it. So you put it in the notes. You have the conversation, Lena, like you said, sometimes you're just doing the dentistry, right? That needs to be done anyway. And
Mhm.
then they'll say later, after you're doing the expansion, they'll say, you know what?
They're breathing better. And
I'm
yeah.
breathing better,
Mhm.
Yeah, yeah.
because they may not even know that they're not breathing well. And especially a child. I mean, they've been probably breathing through their mouth since they were 2 years old and got that really horrible cold, and they never regained nasal breathing again,
Yeah.
which happens. So, yeah, they think
The,
they
the
breathe
ep
just fine.
yeah, the epithelium of the nasal cavity changes if it's use it or lose it sort of situation. So
Yes.
diffuse
Yes.
atrophy is a real thing. You can change the maxillofacial structure, but if the function is not regained through breathing reeducation, they're going to feel like they're not breathing through the nose well. If you do the nose score, you'll see they're like a 15. So they're going to be mild. So it's not really an obstruction issue. It's like a disuse issue.
And on that, Stanley Liu made a really good point. Again, we don't have any data or information on this yet, but it makes sense. Um, when we're improving the volume, is it necessarily the volume, or is it that, and or we're also creating new epithelium with a new sensory system, if you will, is being regenerated, if you will, kind of a second chance. What is even going on physiologically there? I mean, time will tell. Because like his point was, people that have empty nose syndrome, they have tons of volume in
Yeah.
there, too much volume, and they feel like they're suffocating. So it's definitely a lot is coming out about this expansion. And not only, yes, you can do dentoalveolar expansion and make room for a tongue. And if they're breathing perfectly through their nose, then great. But if you are needing that, tooth centered in the bone, maybe a little more nasal volume kind of expansion, yeah, you're getting more volume, but we're also creating new epithelial layers, to your point, Lena. And there is an autonomic nervous system aspect to this. There is a feedback mechanism to the brain, use it or lose it kind of situation. So it's exciting to actually be doing this stuff now, because we're in the trench. I mean, we want the answers now, but wow, to be in our profession when all of this exciting information is unfolding is kind of fantastic.
It is exciting, and it's difficult to go back and think, oh, how would I practice without it? Well, I'm not without it. This is where I am.
Right, right.
The good thing, Stacy, earlier when we had a discussion with Maggie, we are talking about like access to care. Like I think more and more dentists are starting to be like more aware. I mean, the good thing with ASAP now is we have a section on our website where patients can actually find an ASAP provider. Lena, I mean, like your reputation is like skyrocketed now. So it's like, where are your patients finding you? Like, the average commute. I mean, like, what's your practice like now?
I am getting some patients through Instagram because with the help of my uh, assistant, who is a dentist in Ukraine and who's
Yeah.
been really inspiring and getting me on camera.
Yeah, I know. I
I'm
noticed like you've been showing a lot of really
Yeah, yeah.
amazing.
She's really pushed me. She's done she's been an inspiration for that. And I'm actually treating her sister, so that's who is a twin, which is kind of amazing. I'm getting patients through Instagram. I think people really like to hear about how things are done, and they want
Yeah.
more information, and I like to break things down in a way that's accessible, so it's not scary to patients. Maybe it's still scary, I don't know, but at least I'm trying to make it so that it's understandable.
Yeah.
I want to answer their questions, because there's just like not a lot out there where they get immediate feedback. I think I'm getting some patients from Reddit. I don't know. I don't see anything about myself on Reddit, so I don't know what is in there. I
Reddit,
don't know what to
there's
go
a
in there.
secret community Reddit.
I don't know what it is. I had some patients tell me that, you're really big on Reddit, and then I went in there and I didn't see anything about myself.
Oh,
So
that's
it's more
interesting.
deep inside, and I don't have access. But my web design company, Medical Bound, really optimized my website. I love my website. I love Medical Bound. They've been my pages fairies. And we just did another photo shoot. So I think my website is really well positioned, and I try to um, have decent amount of information there on my Instagram. TikTok, I don't understand. I
Oh,
don't
I know. I'm
I have
trying
not
to,
got on TikTok.
I created a
Huh?
TikTok. I just
It's too
don't
many.
use it. It's like, but other people are crushing it on TikTok. Do you know what I heard recently? Is that I was talking to a marketing guy, and 5 years ago, he said, I would have said, do not get on TikTok. He goes, Stacy, now you have to, ASAP has to have a TikTok. So I
Yeah.
created it, but he said the demographic like evaluations right now that women between the ages of 30 and 50, the majority of women in that age bracket are getting their news from TikTok. Like that's where they get their information. And I'm like,
No, I don't
I'm
know.
50, so I'm
Maybe
51
not.
next month. So I guess that's why I don't do it. I'm like,
I don't know. I don't get my news from TikTok. I also get a lot of referrals from my functional and speech therapists and
Mhm.
some colleagues in the city who I'm very grateful for knowing them. And, it's just really nice that
I mean,
it
you're the
feels good
go-to
when
in
they
New
put
York.
this trust in me.
Yeah.
Um, but if I get a client, if I get a request from California, I refer them to California gurus. It's just like to Richard Tang, and like they don't need to fly across the country. It's fine. I'm
oh, I
grateful
kind
for
of
my
it
mentors.
just cut out on my end. Did you guys freeze up a little bit?
Mm,
Yeah,
I,
I'm good.
It froze up for me, so I didn't hear, but you said like in California you would refer to like Richard
I
Ting.
would refer them to Richard Tang and Audrey Yoon. Yeah, I don't
Oh
think
gosh,
people need
those
to.
two are amazing.
Yeah.
Amazing. I know that, you know, we've got to cut this for you to get to the rest of your day, Lena, pretty soon. But I was going to go over some of the, before I do your fun questions at the end, I was just
Okay,
going to go
sure.
over some of the courses and maybe we could even talk a little bit about, you can give your feedback on those things too. But I just wanted to let the listener know that, keeps hearing about education and they're like, well, how the heck do I get education on this topic? There are lots of different options out there, but ASAP does provide a skeletal expansion course. We have a part two coming up September 13th through the 14th, taught by our one and only Dr. Ilya Lipkin, and our one and only Lena is the mentor for that course. And it's everything you need to know to make aligner therapy predictable and coordinating aligner treatment with MARPE, with TADS. So that'll be a unique, what are you excited about with that course?
I'm always excited to hear the new things that Dr. Lipkin comes up with, because that really gives me a better perspective on how to do my treatments. And I know there are a lot of doctors in ASAP and outside of ASAP who really want to improve their finishing skills, and some of them to
Yeah.
a course that puts everything together, and I think this is it. And I think it's okay to take it even before you take the part one course. I don't know. I think that's a prerequisite
Yeah.
for the ASAP community. I don't know if it's like that for the outside, but I don't feel like it's backwards. You can
Yeah,
really
it's not.
see how you're finishing the case, and that will inform you how you're going to start it. I think even that way is a good way to understand it. And I know Tracy's teaching a course with
Victor.
Dr. Victor.
Yeah.
Yeah, so that I think is an excellent way to understand how you should structure your ortho case, because that is starting with the end in mind.
Tracy, what's that course? Tell us about that
Um,
course real quick.
it's a Airway Smile Design, and I have it with Victor. I can say his last name. He's my partner. I'm always butchering his name. Kachurian, and he's in LA. And it's basically facially and aesthetically driven airway management. And I think what's happened is we've got this influx of doctors learning how to do expansion cases, but with limited aesthetic, restorative cosmetic training. So where it's almost kind of come backwards, and we're seeing the reason why we came together and we're like, all right, these cases really need, I mean, even in our hands, we're finding it's hard to restore them and putting the teeth where they need to be. And so we decided that like there's not a course like it that starts with the end first. So
Right.
basically we take where the teeth is in the face, and we kind of tell you where your limits are non-surgically. And so obviously you're almost limitless from a surgical standpoint because you get the surgeon involved, put the face in, but there's our focus really is about the restorative plan, and where it fits in the face.
Well, I'll
And then
put
that's why
the
like
a link for that course in our podcast too. So if
yeah,
send
that's
me
in
that link so I can stick it in the podcast.
yeah, we're doing that in Charleston this year. Like so we
What's the
did it
date?
Charleston October 17th, 18th. So earlier this year we did it in LA and that like sold out. Charleston, I think we have a couple seats left. But yeah, I mean, I think this is, because I'm seeing that a lot of dentists want to kind of go back to that. Like they don't have the full mouth training. So like Lena started with the New York that
The
course,
FMR course.
FMR course.
Yeah,
And
yeah.
so I think the natural progression should be like, I know how to restore a case and then go backwards, but the middle is gonna be a little bit different now. But your finishing has to still be exactly the same.
Yeah.
Well, it's
The
going to help
problem,
you treatment plan that middle part.
yeah.
So yeah, with the
The
end in
problem that I'm
mind.
seeing now is people don't know what the finish is going to be like, and they're
Right.
just going through that journey. So I hope that Ilya's course is gonna we're gonna put it back together, and then yeah, the course that I'm doing with Victor. But we all talk about the beginning first. Like this is where the face is. This is the maximum that you can go,
Yeah.
and that's why like in my little story I show an after case, and I said, yeah, I can probably go more, but you'll be outside of the lips. Like in that case, we're looking at where the canines are. Like you can expand more, but it doesn't mean you should.
Right.
I think that's what we're seeing a lot of overexpansion cases that are not facially aesthetics.
Right. And then that's giving an amazing, treatment modality a bad name,
Yeah.
and it's unfair. And that you can
And
say
much
that
of a
with
good
anything
thing.
in dentistry, it's like you got to do it. Please don't give, everybody just because you see a few cases that were kind of oops, please
Yeah.
don't broad brush the whole
You can't.
yeah.
It's
It's
very technique sensitive
yeah, I
Yeah.
mean it's just
and
like
planning
me.
sensitive.
I mean, it's like you have people like me coming in with these broad mouths and then you're gonna expand them more. And it's like, no, you're at the limit already.
Like
And I
That's
think
Tracy
why
is your end result.
I'm
Tracy's smile is your
yeah.
end result.
but then
Yeah.
people want more than that. And I think that's where you go outside the facial limit.
The
Um,
patients, well, this is the issue.
yeah.
They come with seemingly restricted nasal breathing or something changed in their breathing, and they know that Marpy helps with that, and they say, expand me just a little bit. But you have to know, like can ask for that, and they'll be a little bit sad if you tell them that that's not the right thing to do, but you can't do that because
Yeah.
that's not the solution to their issue. There's
Yeah.
something else, and that's why you have to work with other healthcare professionals to identify what that is, because changing their facial structure to expand them a little bit to give them nasal breathing. And what if it doesn't? Because it doesn't always. There's something else, and you've just ruined their smile. And then
Yeah.
you
And
have to
you
put it
can't
back
go
together.
backwards. I mean,
No.
you can't go
No.
You
back.
can
Once,
turn it back. I don't know what would happen,
well, I mean, once you grow the bone, I
It's,
mean, and you're kind of settled, that's where you're
yeah,
settled.
no,
Yeah.
no, no.
You're
It's
done.
it's
Yeah.
irreversible. We
Right.
have to understand where we have the privilege to change somebody's face irreversibly, and that is supposed to mean something. Like you can't
Yeah.
go back.
Yeah.
Agreed. Okay, I'm going to go on to some other courses we have, and then we'll wrap things up because I know everybody's got to get on with their day today. So, early ortho intervention, we've got that October 9th through 11th. That's a part two as well. And that's Dr. Courtney Levine. Um, Basically, you're going to be hands-on skills with class two, class three elastics. You're going to leave knowing how to put brackets on and really feel comfortable with intervening early. Then we have advanced frenectomy. That's with Dr. Tracy Tran, September 27th, reviewing the basics of frenum release protocols, wound care, collaboration, case managing. Both the early ortho and advanced frenectomy, the fees are going up August 1st. So jump in before, if you're really interested, I would get going on that. And then we have our immersion courses, and this is starting up again September 29th through December. Right now, we have our second immersion course. You can't join that one, it's closed, but you could join the one that is opening September 29th, but registration closes for it September 29th. And that's basically kind of like our Sunday chats. You're learning at home, you're doing the modules, education in your PJs, drinking coffee in the car, listening, like Lena was talking about earlier. But then we get together once a month and we discuss, ask questions, and give that feeling of camaraderie and learning from each other and pull you out of your silo so you can learn in a community. And with that, I'll put those links in the podcast. And I wanted to get to my questions to you, Lena. So, first question is, If you are going to go on a vacation, we're in the summer now. So if you're going to go on vacation, are you going to pick leisure or adventure? Like
Oh, that's a good
whitewater raft,
one.
huh?
That's a good one.
I'm trying to predict when I ask these questions what I think she's going to say, but
Adventure.
whoa,
Yeah.
I thought leisure. Oh,
I
that's
would think
Well,
leisure too, because like she's very like namaste, you know.
yoga, flip-flops. Oh,
you have to balance. One has to
okay.
be leisure, the next one has to be, oh my God, I didn't die. That's great.
Okay. What would be the adventure? Like whitewater rafting, mountain climbing? What are you doing?
It's probably like a long hike. The last adventure that was kind of intense was hiking in Aspen. It was 4 days, and
Oh,
the elevation thing was pretty intense. And it was a 4 day hike carrying everything. Uh,
4 days?
yeah. Nobody
Oh
would
my
think
gosh.
that.
We
But
walked in
I,
Central Park for 2 hours the other morning and I was sore.
I
Stace, you know
complained
how
a lot. There was not a lot of air.
Stace, you know
But
how
it
we
was
were talking about
epic.
Megan, you asked about like an interesting trip, something that happened on your trip or
Yeah,
something like
funny
that.
vacation.
So, you know, when we had our TMD course in Vegas, Lena asked me, Lena's like, "Hey, do you want to go on a hike?" You know, this is like me early on in my hike journey where I'm doing like 30-minute hikes. And I'm like, "Yeah, I want to go on a hike with you." So I went with Lena on this hike. And then we're on this hike, and she's like, "Yeah." And then she talks about like all these long hikes, like these 4-hour hikes, 1 day hikes. And then I start to get a little bit of anxiety because I'm like, who the hell am I walking with? And then as we're in the hike, she's like, "Yeah, you know, we're like 2 hours into the hike." And I'm thinking, like, well, that means it's 2 hours back.
Yeah,
And I
you
was like,
kind
"Oh
of need to know
shit.
who you're
Can we
hiking
turn
with.
can we turn around?" I was
You did so well. You showed zero fear. I felt I was like I guided these people into the desert and then I guided them out and everyone survived. They told my husband. He was like, "Oh, good."
That's so
Yeah,
great, honey.
I was like, my anxiety kind of kicked in when she said, "We're 2 hours." It's like, that's 2 hours back.
I have all trails maps, so I download the map, so
Yeah,
I
she
knew
was
that we're
good.
going to make it out. And we had water. We were good.
Yeah,
Well,
she was
speaking of your
good.
husband, I was going to mention something funny that happened before we recorded. So Lena comes on and it says Matt. And I'm like, who is Matt? But I'm going to go ahead and let Matt in. I'm thinking, oh, wait, maybe that's Lena's husband. So we start playing around with the controls. And I'm like, Lena, and Tracy discovers you can put lipstick on and a filter and eyebrows. So I think I told Lena you should surprise your husband. She's going to leave her name on for his next Zoom meeting, but I think she's going to put some eyebrows and lipstick on for him too. So when he
I
he
think that
pops
would
up on
good.
his
Thank
next
you.
business
Yeah,
meeting.
I think that would be subtle.
I think that would be so funny. Okay, next question. If what's a skill or a talent that you wish you had that you don't?
To control my facial expressions better. I don't know.
Oh,
Well, you know
man.
what's so funny? We were talking about earlier. We're like, that you're just very direct, and some of the things that you say, and I'm like, ooh,
Lena's, Lena's, you know what, Lena, I
I
need
love
that
you
skill
though.
and
It's awesome.
talent too sometimes because my kids will say, Mom, you look so upset. And I'm thinking, oh, wait, am I really showing that I'm upset right now? Like I thought I was tucking it in pretty good, you
I
know?
know I try.
I tried tucking it in. My face just tells pretty much what I'm thinking.
Mhm.
Okay, final question. And I truly picked this randomly because I wanted to know. And then as soon as I wrote it down, I thought, I think I know what you're going to say. If you started another business outside of dentistry, what would it be?
Oh, small dinner parties.
Oh, this isn't what I
Oh,
expected.
you're gonna be coordinating our events. Do you like event planning and stuff?
Not, I love cooking, so but I can only cook for like a small group. I think like 6 people would be the most. Um, I would have to have help if it were more. But I really love designing a menu and being very creative. I
Wow.
have all the spices,
Oh.
all the spices.
Golly, we do need
Yeah,
to
and I
utilize
like
Lena way
to
more than as a
well
mentor.
from
And
different
I didn't know
recipes.
she was a real good
Yeah.
cook. You know, I'm like
It's on
all
my
about.
Instagram. Well, I
Well,
haven't posted like on
I
my
Yeah, I haven't seen a lot of your food posts. Oh, because like I mean, I don't cook, but I eat.
I
I
do too.
know,
I
yeah.
eat.
I
Lena,
feel like
Lena, I want to promote because I really thought you were going to say something else. So you
what
once again, you shocked me.
what did you think?
Well, because you have that total amazing business creating those beautiful lamps.
Oh, well, as far as I'm concerned, this already exists. We just haven't
That is a good,
Okay, what
valid
is
point.
that? Yeah, what is that?
My husband designed, well, we co-designed a lamp. The reason why he designed a lamp is that we couldn't find anything that we really loved, and the Arco lamp was just like um, this quintessential perfect Italian design, but it wouldn't really fit in our living room, and we just wanted something different. So it's something very Brooklyn. And so the concept is that this is a solid reinforced concrete base with all of the electronics inside the base.
Oh, I gotta
And
see this. Yeah.
it's a bent wood. I can't zoom into that, but you can certainly link to our website.
I'm
Uh,
going to put a
it
link
has
to your website in the
it has
podcast.
a steam bent wood arm. The steam bending of the wood is my contribution to the project because even though he's a Princeton trained architect, for some reason he didn't know that part of furniture design, and I felt just so incredible that I knew something about furniture
That he
design that he
didn't.
didn't. It was like steam bending, Vikings, Stoney chairs. And he was just like, no, no, okay, fine. So for a bit, he tried to force bend them. It snapped. It almost killed him. I was like, maybe now we try. So, uh,
Maybe now we try.
so he designed a steam bending chamber. We learned how, for how, like the ratio of how much time for the amount of wood. He designed this amazing template. So we put the arms on the template, they stay there for a day, and then you get the shape that's
It's
holds the wood.
beautiful. Your lamps are an art
Thank
piece.
you. Okay,
They
yeah,
are
this is exciting.
beautiful. I forgot how I found it. I'm like, Lena, what
It's probably
else
on
do you do?
Facebook. I put it on Facebook.
Oh,
So
I gotta look at these
the
lamps.
title.
They're
Yeah.
Yeah.
beautiful. I'll put it in the podcast link too.
If you'd like an order.
Yeah, they're beautiful. They are absolutely
Yeah.
beautiful. So
We
congratulations.
Thank you. We went to ICFF. It's a furniture and lighting exhibit, and we sold one. I was so excited that we sold one. Somebody wanted our product. It's in somebody's living room. I'm delighted. So as far as I'm concerned, it exists. We're just not super famous yet.
Well, maybe we'll make you famous. So
Thank you.
we're going to get that information out. I just was so impressed with what you guys did. And I think it's fun that you
It
guys
was
did it as a
fun.
couple. You know,
It
it's
was
like,
in our home. We did it in our living room. So our
Oh, that's so nice.
yeah, it looked crazy.
I think you guys, I do like to watch you guys do a lot together and it's fun to watch. You guys, I can tell are really good friends and that's a very neat thing to see. So, well, I'll put that in the link as well, everybody. And I appreciate everybody coming today. I appreciate you, listener, taking the time to listen. And we'll see you all next time. Thanks for joining us
Thank you
today.
so much
Bye,
for
guys.
Bye,
Bye.
everybody. This podcast would not be possible without the inspiration of my dad, Dan Becker, and creative direction and editing from the talented Jason Becker, Benjamin, and Judah Walker. To stay connected and keep the conversation going, be sure to subscribe to our podcast and visit our website at asappathway.com. And remember, the information in this podcast is for educational purposes only. It's not intended to be used as medical advice to replace your healthcare provider's diagnosis or recommendations.